I was named after my grandfather, and my grandfather was born in Russia. Or actually, it was an area in Europe called Prussia. And he came to the United States and lived in Pittsburgh. I actually grew up in the city in an area called Squirrel Hill, and I graduated from the University of Pittsburgh in 1979. Then I attended dental school, and that's what brought me to the Philadelphia area. I graduated from Temple Dental School in 1983. And after Temple Dental School, that's where I started into practice with Philip Korn and Sam Paul in Northeast Philadelphia. I see a wide range of patients. Much of my practice is devoted to cosmetic dentistry and reconstructive dentistry. Now, you might ask, well, what do I mean by reconstructive dentistry? The term reconstructive means I'm rebuilding. I might be changing all of your teeth at once. Now, obviously, if I'm changing all of your teeth at once, you want something that's cosmetic, that's going to look natural and be a very nice smile. So, cosmetic being maybe you just want to change 1 or 2 teeth in the front, then that's strictly a cosmetic type of procedure that I love to do for people, and it's not a reconstruction. It's just something that is going to help a patient be more satisfied in their life and feel better about themselves. Whereas when you're doing reconstruction, you're changing the whole mouth and you're improving the life and the quality of health of that patient. When a patient decides to have cosmetic dentistry or reconstructive dentistry completed, there are many benefits that are there for the patient to experience. The biggest benefit is the fact that if you're having a reconstruction, that means that your oral health is not good to start and you're going to improve it. And when you improve your oral health, you're not only improving what's happening in your mouth, but you're also improving how your food is digested, and you're also improving the health of your heart, because there are many studies now that correlate between the health of your mouth and the health of your heart. So that is a very big benefit of what happens when you improve the health of your mouth. The benefit of the cosmetic end of the dentistry is the fact that you're going to feel better about yourself, which means you might get a better job, which is going to further you along in life on the financial ladder. Or you're just going to feel better about yourself in social situations. And there's a whole gamut of things that could happen if you're just feeling better about yourself. It makes you feel good. And if it makes you feel good, you're going to be happy. When a new patient comes to see me, I make them feel at home. Everybody who works in my office, we come in and we have a great time every day. We love doing our jobs. And because of that, the patients come and they feel great about us and about the dentistry that we're doing with them. When a patient comes through my door for the first time, I am committed to them to give them undivided attention. I'm committed to them to be honest with them and to make sure that they understand what type of dentistry that I intend to do and that they want me to do. I intend to be perfectly honest with them and not hide anything. I want to do the best for my patient that is possible to do within their expectations. People pick my practice mainly because they trust me and they trust my office staff. I always give them the true reason why things happen. I don't sugarcoat anything, and I treat people like people. They are not numbers in my office. So I don't treat a high volume of people who come in and I run from room to room to room to treat each patient. I treat patients one at a time and I give them my undivided attention. And that's really why my patients come to see me. They also always comment to me about how high-tech our office is. We tend to use the latest equipment and we're always on the cutting edge when it comes to the type of dentistry that we do for them. Many of my patients have been in this practice for over 50 years. When I started in this practice with Dr. Korn and Dr. Paul, the practice at that point was already 30 years old. And many of the patients that I started seeing when I was on Cottman Avenue are still coming to see me. So I have seen people grow and have children and then have their children have children. So I've seen generations of patients. And I have to tell you, there's nothing more rewarding than seeing people grow up and have children and have me treat their children. The length of time, and many patients are concerned about this, how long does it take to do porcelain laminate veneers? In straightforward cases, simple ones, it really only takes 2 visits. The visit to take the impression and the visit to bond the veneers in place. The typical fee for a porcelain laminate veneer, it can range anywhere from $1,000 upwards to $1,500. And the range really is devised depending on the difficulty of the case, whether or not we're just doing one veneer in the front to try to get to match all the other teeth, or whether or not we're doing a whole mouth of veneers, a full smile. And obviously, if we're going to do a full smile, then the veneers are going to be less expensive. Many of the procedures that we do, whether it be cosmetic procedures or full mouth reconstructive procedures, a lot of those procedures are not covered by insurance. But our office, we go to great lengths to try and help you with your insurance coverage to get whatever we can from the insurance company to help you with that. But as you know, cosmetic dentistry can be costly, and most people only have certain insurance limits, which the insurance limits are not significant compared to what cosmetic dentistry or full mouth reconstructive dentistry would cost. So we have other programs that we offer. We accept credit cards, we accept payment plans, and we also work with finance companies that work similar to same as cash. So we try to be very patient-oriented when it comes to financing the dentistry that you want. There's a lot of things that I enjoy about being a dentist. One of them is seeing the patient in the end smile and get up from the chair and give me a big hug. And that's one of the most rewarding things in the world. When I see that excitement, when the patient picks up the mirror or looks at the digital image of what I took of their mouth and their eyes just light up and say, yeah, that's what I really wanted. That's one of the most rewarding things for me.